In this episode, we're going to move from identifying risks to making decisions about what to do with them. And we're going to focus on how to explain those decisions in a way that actually persuades people. New learners often assume that once you find a risk, the answer is always to fix it immediately. But real organizations have limited time, limited money, and competing priorities. Risk treatment is the process of deciding how you will respond to a specific risk, and cost-benefit analysis is the method you use to show that your chosen response is reasonable and worth it. The most important idea is that persuasion in risk work is not about sounding dramatic. It is about connecting the risk, the treatment, and the trade-offs to outcomes the organization cares about. When you do that, your recommendations stop sounding like opinions and start sounding like decisions grounded in facts and priorities. By the end, you should be able to describe the main risk treatment options and explain how to compare them in a way that helps decision-makers choose confidently. Before we continue, a quick note. This audio course is a companion to our course companion books. The first book is about the exam and provides detailed information on how to pass it best. The second book is a Kindle-only ebook that contains 1,000 flashcards that can be used on your mobile device or Kindle. Check them both out at cyber.author.me in the Bare Metal Study Guide series. Risk treatment options are usually described as a small set of broad choices, and the simplicity is helpful for beginners. One option is risk avoidance, which means you change the plan so the risky activity does not happen, like deciding not to launch a feature that requires collecting sensitive data you cannot protect well. Another option is risk mitigation, which means you reduce likelihood or impact by adding controls, improving processes, or redesigning parts of the system. A third option is risk transfer, which means you shift some of the financial or operational burden to another party, such as through contracts, insurance, or outsourcing, while recognizing that not all responsibility can truly be transferred. A fourth option is risk acceptance, which means you decide to live with the risk because it is within appetite and tolerance or because treatment costs outweigh benefits. These options are not moral judgments. They are strategic choices, and the best choice depends on context, constraints, and what the organization is trying to accomplish. To choose among those options, you need to understand what a risk statement really contains. A useful risk statement describes a scenario, an asset of value, a threat or event, a weakness that allows harm, and a consequence. Without that scenario, treatment choices become random because you are not sure what you are treating. For example, if the risk is unauthorized access to customer accounts due to weak authentication, mitigation might involve strengthening authentication and monitoring account behavior. If the risk is service downtime due to a single point of failure, mitigation might involve redundancy and improved recovery capability. If the risk is that a process depends on one person's knowledge, mitigation might involve documentation and cross-training. The scenario format keeps treatment tied to the actual pathway of harm. Beginners should also learn that treatment choices operate on two levers, reducing likelihood and reducing impact. Some treatments primarily make the bad event less likely, like tightening access or removing exposure. Other treatments primarily make the outcome less damaging, like limiting blast radius, improving backup and recovery, or segmenting responsibilities so a single mistake cannot cause widespread harm. Many strong treatments do a bit of both, but it helps to name which lever is doing the heavy lifting. This clarity matters because sometimes you cannot reduce likelihood much, so you focus on impact, and sometimes impact is catastrophic, so you focus heavily on likelihood. The point is not to chase perfect safety. The point is to move the risk into a range the organization can tolerate, using levers that actually affect the scenario you described. Now let's talk about cost-benefit analysis, because the word cost can make people think only about money. Cost includes money, but it also includes time, complexity, user friction, operational overhead, and the risk of new failures introduced by change. A security control that is cheap to buy but expensive to operate can be a bad trade if it drains staff time and still fails under pressure. Benefit also includes money, but it can include reduced downtime, reduced likelihood of data exposure, improved trust, and reduced compliance exposure, depending on the organization. For beginners, the simplest way to frame cost-benefit is to compare the expected improvement in outcomes against the total burden of making and sustaining the change. When you do that honestly, your analysis becomes more credible, and credibility is what persuades. A common challenge is that benefits often feel uncertain because you are describing events that might happen. This is where beginners can learn a useful concept. You do not need perfect numbers to make a persuasive comparison, but you do need consistent reasoning. You can compare options using categories, ranges, and relative differences, like saying one option reduces the chance of an incident substantially while another reduces it only slightly, or one option reduces maximum downtime from days to hours. You can also tie benefits to measurable tolerances, like how long an outage is acceptable or how quickly certain issues must be detected. Even when you cannot compute an exact dollar figure, you can still show how an option moves the organization toward its stated boundaries. Decision-makers often respond better to clear movement toward a boundary than to uncertain claims about precise savings. Persuasion also depends on presenting alternatives, because a recommendation with no alternatives can look like a demand. If you show at least two realistic treatment paths, you give leaders a way to choose based on their priorities while still addressing the risk. For example, you might present a stronger mitigation that costs more but reduces risk substantially, and a lighter mitigation that costs less but requires tighter monitoring and faster response. You might also present avoidance as an option if mitigation would be extremely expensive, making clear what the organization would give up by avoiding the activity. By laying out alternatives, you demonstrate that you understand constraints and that you are not pushing a single preferred solution. This makes your recommendation more persuasive because it is framed as a decision point, not a lecture. Another important idea is residual risk, which is the risk that remains after you apply a treatment. Beginners sometimes assume that mitigation eliminates risk, but most controls reduce risk rather than removing it. When you present a treatment option, you should be able to describe what is left and whether what is left fits the organization's tolerance. This is especially important for risk transfer, because transferring a cost does not necessarily reduce the chance of a problem happening, and it does not eliminate reputational harm. For example, outsourcing a service might reduce operational burden, but if customer data is exposed, the organization still faces trust damage and legal obligations. A persuasive analysis recognizes residual risk and shows how it will be monitored and managed, because that demonstrates realism and responsibility. Cost-benefit analysis becomes more convincing when it is anchored in business outcomes rather than in technical features. Instead of saying a control is good because it is advanced, you explain what it prevents, what it detects, and how quickly it supports recovery. Instead of saying a control is expensive, you explain the operational burden, the implementation time, and the friction it adds to users. If you need to talk about money, you connect it to avoided costs in categories decision-makers recognize, like downtime costs, rework costs, incident handling costs, and compliance costs. You also highlight opportunity cost, meaning what the organization cannot do if it spends the budget and attention on this treatment. By speaking in outcomes, you make it easier for non-specialists to compare options and make a choice. It also helps to address common objections before they derail the decision. One objection is that the risk is theoretical, which you can counter by explaining the exposure and why the scenario is plausible without exaggerating. Another objection is that the organization has never had this problem before, which you can counter by explaining that change in scale, exposure, or dependencies can make old history less reliable. Another objection is that the control will slow down work, which you can address by comparing alternatives and by explaining how operational efficiency can improve when risk is managed proactively rather than through repeated emergencies. The goal is not to win an argument. It is to show that you have considered the real-world impact of the treatment. When people feel their concerns have been anticipated and respected, they are more likely to accept the recommendation. For beginners, it's useful to learn that persuasion is also about clarity and accountability. A risk treatment decision should be tied to who will implement it, who will operate it, who will monitor results, and who will accept the residual risk. If nobody owns the treatment, the plan is just a document, and if nobody owns the residual risk, acceptance becomes accidental. When you present a cost-benefit comparison, you should make visible the human effort required and the ongoing responsibilities created. This prevents the common failure where a control is purchased, installed, and then quietly neglected until it fails. A persuasive treatment proposal includes not only what will be done, but what ongoing behavior will keep it effective. Risk acceptance deserves special attention because it is often misunderstood as doing nothing. Acceptance can be responsible when the risk is within tolerance or when treatment would cost more than the harm it prevents. But it must be deliberate and documented. Deliberate acceptance includes explaining why treatment is not chosen now, what conditions would cause a revisit, and what monitoring will detect changes that make the risk unacceptable. For example, accepting a low-impact risk might be fine until the system becomes more exposed or until it begins handling more sensitive data. Acceptance also depends on having the right approver, because not everyone should be allowed to accept every kind of risk. For a beginner, the lesson is that acceptance is a treatment choice with obligations, not an excuse to ignore discomfort. To bring everything together, choosing risk treatment options is about selecting the response that best fits the organization's goals, boundaries, and capabilities, while being honest about trade-offs and residual risk. Cost-benefit analysis Persuades, when it compares realistic alternatives, accounts for total cost, including operational burden, and ties benefits to clear outcomes like reduced downtime, reduced exposure, or faster detection. The best analysis does not pretend to predict the future perfectly. It shows consistent reasoning and clear movement toward the organization's risk tolerances. When you can explain why you avoided a risk, mitigated it, transferred parts of it, or accepted it, and you can show what you gain and what you give up, you are doing risk management as decision support rather than as fear-based messaging. That skill is what turns risk work into action that leaders can approve and teams can execute.
Thanks for listening. For more audio courses, daily newsletters, and more, please visit DailyCyber.News.